my name's Mia McKinstry, and I'm one of the new CA2s.
My name is Matt Hallman. I'm the program director here and have been for the past 8 years.
My name's Flora Li, and I'm one of the cardiac anesthesia faculty at UW Medical Center.
And my name's Cameron Donald. I'm one of the CA3s.
And Flora, you're not just a faculty member, you're a former resident of the program.
Former resident, former fellow, just never left, yeah.
Maybe start out by just asking you to talk a little bit about how the program has changed or evolved since you were a resident and the things that you see that are different now than they were a few years ago.
Yeah, well, back in my day. No, I think there are a lot of things that have changed in the details. And I think that overall the structure has changed a little bit, though the core of it seems to have stayed the same. You know, the sites have not changed. The hospitals remain the same sort of patient mixes, the same sort of cases. I think what's really changed is that year to year I see the rotations changing, like specific ones, specific lengths of rotations. Pretty much it seems like based on the feedback from each year as things change.
I think we try really hard to be responsive to feedback that we're getting from residents and to actually make changes when it makes sense to make changes. Was that something when you guys were thinking about coming here and choosing Washington for your training? Was that perception of the program's ability to change something that figured into your decision making at all?
I think that when a medical student is choosing a place to train, that actually is an important factor. You want to know that you are going to an institution that is not stuck in the past and just stuck in old ways. It's able to evolve appropriately and actually be an innovator in its own field. And so I think it's really important trying to assess that in the interview day and get the sense that, okay, like UW is hiring leaders in its field and really looking at the future of anesthesiology as opposed to just being comfortable in what it knows.
Yeah, and I think I help a lot with the recruitment of applicants in this program. And a question I get a lot is, do you feel like your faculty, your program leadership is approachable? And I think when I was looking at UW, it's a big program, and I think a lot of people assume it's easy to get lost in the shuffle because of that. But I found it very easy to just email or text Dr. Hallman for things. I was bothering him a lot a few months ago asking for a letter of recommendation for a fellowship, and he's so approachable, and so that's really nice. And he does take our feedback really, really seriously. Every year I've been in residency, there's actually been pretty big structural changes to the program based on feedback each class has given, and so it's cool to see how things are different, and sometimes you feel a little jealous because you're like, whoa, that was so much better than when I did it. So.
Yeah, and I think a big part of that is trying to make the program, even though it's a big program, be one where everybody can find their niche and a place where they fit in and create an experience that's the experience that they need for whatever your professional and personal goals are down the road. I think one of the ways that happens is through how we set up our rotations, and we think about sequencing the different experiences that you've had, and you guys are both entering into your final year of training now, second year of CA2 year. How has that experience been for you guys? What has your personal experience been with the ability of the program to sort of respond to what you're looking for?
I think the program's been really responsive to what I'm looking for. So I came in wanting to go to fellowship. I wanted to do peds, and so I was able to get that experience really early. I'm someone who's doing extra peds throughout my residency training because I requested it. But I think overall, in terms of the program sequencing, it does just build in a really nice way. So I'm not someone who's particularly passionate about the ICU, but I feel like I actually have gotten a really strong ICU training. And so this last 2 weeks, I was just the pre-10 fellow in our SICU here at UW. And I was really struck because it's really cool for us because we get to work with our interns. And so we get to do a lot of teaching, we help with admits, and the interns kept confusing me and being like, oh, we're never going to see you again. I'm like, what are you talking about? I'm going to be here for another year. And they're like, oh, you're not graduating right now. And I was really struck by that because I've never felt really strong as an intensivist, but I think it was a nice point of reflection to be like, oh, I've actually learned quite a bit and feel relatively comfortable in this space, which is not a place I would have expected myself to be, given my own interest.
Yeah. Flora, how was it for you choosing cardiac? When did you make the decision to pursue CT anesthesia?
Yeah, I knew coming in, like I think a lot of people know coming in, that there's sort of a way that you lean. So I was thinking already that I would be interested in ICU or cardiac or both, which is an option these days and is increasingly popular. And so you really don't know until you do it. And I think that it was really helpful for me to have done that amount of ICU. You know, I did take an extra year to decide, so I had that extra amount of time. But then when I did my cardiac rotations, I love the cases. We do such interesting cardiac cases here. Really, like the case mix is insane and incredible. And you come out of it and you either love it or you hate it. You know, people come out either thinking like, that was so interesting, I learned so much, and I never want to do this in my career. Or you come out and you're like, that was cool, let's do it. And I was the latter. And then the question kind of came down to, did I want to add ICU to that? And I think in the end it just came down to like, what did I want to spend most of my time doing, and did I want to split my practice the way that our people who do both CT and CT ICU do. And I didn't. I just wanted to do more cardiac bypass cases. So that's sort of where I landed on that.
And you had two other things I think that are worth commenting on. One of them was you decided to pursue research. Mm-hmm. And maybe a little bit about what that looked like.
Yeah, well, one of the strong draws for this program for me was that I matched into the Benica track. And there are only really a handful of programs around the country that offer a comparable track. And so looking at the one here, I liked that a lot of the research time was integrated into the residency. You know, a lot of the other ones that I looked at, it was like you did residency and that's all you did. And then came CA3 year, you would get maybe 6 months in a row. And so you would show up, you know, having been very clinically focused, and then be expected to pick up a project, find a mentor, learn about the topic or think about the topic, and then be productive in 6 months. And like having done research before, I think it's not impossible. Certainly like you can find a great match for that sort of schedule, but it seemed very difficult to be productive in that time. So here the time's more slotted in, you know, so I got like a month intern year actually. Well, actually I got 2 months intern year. And so when I showed up, you know, bright-eyed, bushy-tailed, like I could meet everybody and then like have the time to figure out if there was somebody whose research interests I aligned with. And that's when I figured it out. And then like we were able to say, okay, well, maybe we should submit paperwork, you know, maybe we should get an IRB going. That takes time. And then CA1 year I had a month, CA2 year I had some time. And then by the time I hit CA3 year, when I had a couple more months of time, like I already had something going and I had a relationship established. So that was really appealing to me, and that did actually work out pretty well.
Yeah. Cool.
I think it's really great about UW though that because we do have a very diverse set of specialists, but also a lot of attendings who wanted to stay as general anesthesiologists. I feel that me coming into residency, I'm very open, still open to fellowship, but also very open to getting a job directly from residency. And I don't feel pressured one way or the other. I feel encouragement for whatever is going to fit my future goals and my own lifestyle, my own personal life, as well as my career goals. And I'm excited to see what I end up doing.
I mean, I think there's a stereotype, if you're not really familiar with the University of Washington, that this is a big research institution and that everybody we train here ends up being a researcher of some shape or form. And That's really not true at all. I think when we look at our graduates, we produce an equal number of folks going on to fellowship, subspecialty training, going out into the community. About half of our residents end up involved in research during their residency, but don't necessarily continue on as researchers after they leave. So I think we really try hard to make it a place where, whether it's clinical work you're looking at ultimately pursuing, you want to be an academician, you want to be a researcher, or you have something else that's a passion that you want to pursue, that we give you the opportunities for that. I mean, Cameron, I think about you and the things that you've been involved with as a resident outside of the clinical stuff. You've gotten really involved with our EDI council and a few other things.
Yeah, I think the nice thing about being at UW is there's just so many options to do whatever you want. So I'm very interested in education, I'm interested in diversity and inclusion work, so that's been a big part of my residency experience, and that's been really well supported both by our department and through other departments at the university. And then I think another interest of mine, maybe selfishly, is just wellness and just like making sure everyone's happy, because I just want to be happy all the time. So I like to go in the city and do fun things. And so with the support of Dr. Hallman and a lot of our chief residents, and just with the enthusiasm of all of my co-residents, like Mia, who I think we all just like to have fun and hang out with each other. So we have various wellness efforts that are going on right now too. So I think, and people have been very encouraging towards me around whether or not you go to private practice versus academics, and they kind of really discuss or encourage you to take all these experiences and apply them to whatever and make them viable options for whatever you want to do, which is also pretty nice, because I don't know where I ultimately want to be, and so it's nice to know that you can just pursue your passion projects and people will help you get to where you need to be.
Actually, a conversation we had recently was about where in the country you are thinking of eventually settling down. And another really great thing about UW is there are alumni from our department everywhere. I think that if we wanted to go to the East Coast or elsewhere, there is not going to be a difficulty finding somebody or somebody who knows somebody that we can get to know and get to know that institution and see if our training at UW would be something that fits well for that institution. Yeah, it's great. It's a great alumni network.
Well, guys, thank you so much for the conversation today. I think we're about out of time here. It's been wonderful talking with everybody.